HCN welcomes you to a special program on World Heart Day. As we know, the heart is the most vital organ of a human being. And in today's world, with so much of stress and pressure on the heart, it is important for us to understand some of these important areas. We have today in our midst Dr. Lenny D'Costa, a preventive cardiologist and a geriatric physician of eminence from this beautiful state of Goa. We're going to talk to him on this special area of his treatments. Dr. Lenny, welcome to the program on World Heart Day. And thank you for being with us. The first question I'd like to ask you, Doctor, is I understand that you're doing some special treatment. And through this treatment, you help patients to avoid angioplasty or a bypass. Can you tell us something about this treatment and how it works?
Well, we must first try and understand what an angioplasty does or what a bypass is supposed to do and in what condition you use it. Now, I'll give you a little bit of a brief about the condition of the heart when these two procedures are required. You see the heart, when you look at your left hand, your heart is exactly like this. On the surface, you have three vessels that sit on the surface.
Okay.
And these vessels supply the heart muscle. Now, you must understand that the heart muscle works 24/7. It's continuously pumping. It's one of the most tireless muscle that works all the time. Without that, we would be dead. Now, it requires its blood supply, it requires its oxygen supply, it requires its energy supplies, and all that is supplied to it by the blood.
Okay.
Now, the blood supply to this comes from these three arteries. Now, if any of these three arteries, for some reason, get blocked, you will get that area of the heart muscle not getting enough blood supply and that area dying off. Now, when you have this sort of a condition, an angioplasty, you put a stent, you put a thin pipe kind of a thing, which opens up the artery.
That's right.
It's like a spring that is put inside and it opens up. It's done in a cath lab. When you do a bypass surgery in a theater, you actually remove another vessel, maybe from the leg or from the arm, a vein, and you put it from above the block to below the block. So that's called a bypass. So in both cases, what you're trying to do is improve the blood supply to the heart muscle, nothing else. Now, both these are at best what we can say temporary measures. Why? Because you're only taking care of exact problem that has happened at that point of time. You are not looking at what is the root cause of this problem. Because if you look only at that, then the chances of you getting it again are very high. It's one of the reasons why today people have to go for the second bypass, or they have to go for a second angioplasty, or maybe an angioplasty and a bypass.
Okay.
And they keep getting these problems every 3-4 years because we don't go to the root cause of this problem. So what we do generally, what I do generally, or my team does, is that we look at the root cause of the problem. How has this so-called inflammation? Today we know that the whole problem is caused by inflammation. How has this inflammation started? And how we treat it. So we try to reverse the root cause. In the process, the supply to the heart muscle increases. And we have achieved the objective, because if you're going to do angioplasty or a bypass, you're trying to increase the supply to the heart muscle. We have also done it by not operating you. So we actually go to the root cause of the problem.
So, Doctor, you are trying to say that if you go through the root cause, would be much more beneficial than just having an angioplasty or a bypass.
Yes, because angioplasty or a bypass is only taking care of that problem. Whereas when we do this, your entire circulation to the body improves. Because we are stopping the basic problem of arteriosclerosis, the hardening of the arteries, the plaque formation, the inflammation within the arteries.
Okay.
All this is, and there's a cause to this, and that cause is what we attack. The basic causes basically comes from your food, comes from your water, comes from the air that you breathe. So whatever you do, your air you cannot stop breathing. You see, we have, till about 10 years back, we didn't have unleaded petrol. We used to use leaded petrol in the air. So there's so much of lead still in the air. You're breathing that. You have cadmium and mercury in your fertilizers. Even if you are a pure veg, you still have a lot of metals getting into your body. These are not at poisonous levels.
Right.
They are at that very minor levels which cause what is known as the first oxidation. You see, they oxidize the cholesterol, which is then the cause of inflammation and internal damage. The first reason, first issues that take place when your plaque starts forming, and then it goes through its process, and then you have the block. So it's a whole process that it goes through. Now, if we remove the offending items, these metals out, what basically happens is, even if your artery is blocked, we have nature-given or God-given solution to any blockage in our body. There's something known as collateral circulation that exists. This collateral circulation doesn't open up because of the same oxidation. Now, the moment I remove the metals out, the collateral circulation starts opening up. That increases the blood supply to the heart muscle.
So, doctor, this treatment can be taken by anyone?
Yes, it can be taken for preventive purposes. It can be taken by people who have, let's say, most of my patients who come to me, I've done more than 12,000 plus patients all over Western Maharashtra, Gujarat and Goa for the last 10 years. And most of the patients that come to us are patients who have either done an angioplasty or have done an angioplasty and a bypass, and then they are told again that they have to go for an intervention. Then they come running to us and they say, hey, we need to do something. Now, we generally detoxify them by a process of IV detox, or what is today called chelation. Chelation therapy. And this treatment can be taken by people who have gone through the two procedures, can be taken by people who have been just diagnosed of having had heart blocks but are not yet ready for a procedure, meaning they might be having a small 25%, 30% block, what they call. They can go through it to prevent it from progressing and reaching a situation where they have to undergo a surgery. They can do it. Young kids who start getting the first signs of BP going up, that is a sign that your arteries are getting atherosclerotic. Go and we have a preventive package that we do for them. Those are the people who can go for it. And of course, people who are totally unfit for surgery or any kind of surgical intervention. We have done so many cases where people have been told that to go home and we can't do anything much for you now. Your heart is totally damaged. Those people are still living because we've been able to work with them and to kind of rehabilitate the heart and at the same time detoxify them. So we have kind of given metabolic support to the heart and done that. So it's a whole. We look at the whole aspect of the patient, not just one problem that you go and just remove this block. We need to see that the heart gets enough blood supply, that's most important, enough energy to continue doing its job.
That's nice, doctor. And important point is, since I find this is a very unique way of treating the heart disease. True. So do you feel that, have you done any training or?
Yeah, see, this particular study, this particular system or this therapy is not mine.
Okay.
It exists in over 200 countries across the world.
I see.
It has been in use from the late 60s, but it gained prominence only in the 80s.
I see.
And the reason it was not really taken up as a mainstay treatment was because cardiology at the same time was moving forward. So they found that for some reason that got prominence and this didn't get, because there was no money kept on this. Probably there was no financial gain or economic gain on this. But it has been used all over the world. In America or the USA today, United States of America, 1 in every 4 patients goes for a surgery. 3 out of 4 actually do this. And we are governed by protocols laid down by the American College of Advancement in Medicine, also by the American Board for Clinical Metal Toxicology. But for us across the world, it's the International Board of Clinical Metal Toxicology that actually runs board certification. And I was certified by the IBCMT way back in 2005. So I was one of the first in this country to get certified. And we also still conduct workshops in India for doctors to get certified. Okay. A lot of doctors do practice it across the country. It is not something that I do myself, but the protocols are very well laid down. They're very safe because of the safety aspect. And because of so much of use, the National Institute of Health ran a trial for this because
Okay.
the federal court and the Congress decided that it should be done to see how much it benefits people. So that trial to assess chelation therapy, known as TACT in short,
TACT.
just ended 2 years back, and its reports have shocked the world because it really showed that it does work.
Okay. Doctor, it's an honor for us that you are the first doctor from our country, through this treatment you have done so much of pioneering work. My question to you, to the viewers, I would simply like to ask you a question. There's a word which I find in this area, EECP.
Yeah.
Is this something to do with this treatment?
No. EECP is another form of treatment that we also do, which is also a non-invasive treatment.
All right.
Now, EECP is enhanced external counter pulsation.
Okay.
This is fantastic treatment for people who keep getting pains. See, some of the people, in spite of having done a bypass or angioplasty, still get inguinal pains. Or very early, they don't have too many blocks, but they get inguinal pains. So they cannot be intervened surgically. You cannot intervene a person with 30% block. He's still getting inguinal pains. So these pains which you get while you're exercising or walking are very debilitating. So there is a new technique which is now US FDA approved for angina and even for heart failure patients, where you are put on that machine. I would show it to you later if you want to see it. But you're put on that machine, and it's like a couch, and you have these bands around your lower limbs. So when the heart is relaxing, you have full pressure on these cuffs that are put on your lower limbs, which rushes the blood back to your heart. And in the process, what happens is the same collateral circulation starts opening. So this is a mechanical way of doing it. The chelation or IV detox is a chemical way of doing it. It is the biochemical way of doing it. So we can use both to enhance the effect of the patient. The ECP treatments are expensive, but today many insurance companies do give you reimbursement for it because there was a court ruling in Bombay which forced it to happen. Okay. So we have a lot of ECP centers now opening up. Many mainstream hospitals also are doing it. Ours is the first center in Goa. We have the first ECP installed in Goa. We have not advertised it much, but we are the first ECP, and it's been doing wonders for my patients.
Okay, doctor, thank you. I think we'll take a short break at this moment, and later you can also show us around the hospital.
Yeah.
We'll take a short break now and be back in a few moments. You're watching HCN. Stay with us. Join us in a few moments.